Most compliance disasters don't begin with one massive mistake. They begin with one small shortcut that nobody questioned. A password written on a sticky note, a missed sterilization log, an eyewash station that doesn't work properly, or a former employee who still has access to patient records months later. And over time, those small oversights become major liabilities. Hi, I'm Kelli Ngariki with Healthcare Compliance Associates. We help healthcare and dental practices across Oregon build safer, smarter systems around OSHA, HIPAA, and infection control. And in the next few minutes, I want to show you the hidden compliance risks that we see every day, and a few simple ways practices can reduce those risks before they become bigger problems. Here's what makes compliance risks so dangerous. Well, most offices are not intentionally unsafe. In fact, most teams care deeply about patients and staff. The real problem is normalization. When people do the same thing every day without immediate consequences, unsafe habits slowly start feeling normal. And once that happens, blind spots develop. Some of the highest risk offices don't look disorganized. They actually look calm, comfortable, and experienced. Because over time, people stop noticing the shortcut, the inconsistency, or the missing step. We hear this phrase all the time. We've always done it this way. But compliance changes, risks evolve, technology updates, and staff changes. And the offices that struggle most are usually operating reactively instead of proactively. They wait until an OSHA inspection, a HIPAA breach, an employee injury, or a patient complaint forces them to pay attention. And when you start looking closely, these hidden risks show up everywhere. Section 1, Hidden HIPAA Risks. HIPAA risk number 1, password and access problems. One of the biggest HIPAA risks we see is weak login security, and usually it starts as convenience. Someone shares a login because they're busy. A password gets written down because nobody can remember it. A former employee leaves suddenly and nobody realizes they still have remote access to systems weeks later. We see this often. And the scary part is, these situations usually sit unnoticed until there's already a problem. One simple improvement is creating a termination checklist. So former employees immediately lose access to systems and patient information. HIPAA risk number 2, improper access and disclosure of patient information. Some of the most common HIPAA violations happen during normal daily operations. Staff accessing records they are not authorized to view, patient information being discussed in public or shared spaces, inadequate safeguards that allow unauthorized access to protected health information. And because these behaviors can become routine, teams often stop recognizing the level of risk involved. A simple way to reduce this risk is making sure employees only have access to the information necessary for their role. HIPAA risk number 3, texting and communication shortcuts. Now this one has exploded in recent years. Staff texting patient information from personal phones, using unencrypted emails, and sending PHI quickly just to keep the day moving. Nobody is trying to violate HIPAA. They're trying to help patients efficiently. But speed without systems creates risk. One simple step is making sure your team clearly understands which communication methods are approved for patient information and which ones are not. Section 2, Hidden OSHA Risks. OSHA risk number 1, training gaps. One of the most common OSHA problems we see is incomplete or undocumented training, and it usually happens slowly. A new employee gets onboarded during a busy month, annual training gets delayed, documentation gets misplaced. Then one day, an OSHA inspector asks for records and nobody can find proof of the training. One trick to stay organized is scheduling annual OSHA, HIPAA, and infection control training dates right after you complete this year's training. OSHA risk number 2, eyewash stations. Eyewash stations are another major issue we frequently see in healthcare practices. Eyewash stations that are blocked by supplies, units installed in dirty sinks that are not cleaned regularly, missing weekly flush documentation, or stations that may not function properly during an emergency. And because eyewash stations are rarely used day to day, problems often go unnoticed until someone actually needs them. One quick monthly walkthrough to confirm the station is accessible, clean, and documented can prevent major problems later on. OSHA risk number 3, sharps and exposure risks. We also frequently see overfilled sharps containers, inconsistent exposure reporting, and unclear injury response procedures. These aren't just paperwork issues, they're team safety issues. One of the best things practices can do is make sure employees know exactly what to do if an exposure incident happens before an emergency ever occurs. If you're realizing your office may have some blind spots, you're definitely not alone. That's exactly why we offer a free 20-minute compliance risk review for Oregon healthcare and dental practices. It's a simple conversation designed to help you identify hidden risks before they become big problems. Sometimes an outside perspective is the best way to see what's been normalized inside of your office. Section 3, hidden infection control risks. Infection control risk number 1, sterilization documentation. One of the biggest infection control problems we see is incomplete sterilization documentation. And this creates a dangerous false sense of security because often the sterilization itself may have been done correctly, but when spore test records and sterilization documentation are incomplete or missing, the practice cannot demonstrate that instruments were consistently processed correctly. Create a routine of having a supervisor verify sterilization logs at the end of each day or week. Infection control risk number 2, surface disinfection errors. This one surprises a lot of teams. Many disinfectants require specific contact times to actually work properly. But in busy practices, rooms get turned over quickly, surfaces are cleaned but not fully disinfected, and shortcuts slowly become routine. A simple solution is using a Sharpie to write the contact time on disinfectant containers. Infection control risk number 3, waterline maintenance. In dental practices especially, waterline maintenance becomes a major hidden risk area. We often see inconsistent testing, incomplete documentation, or maintenance systems that slowly drift away from manufacturer instructions. Again, not because teams don't care, but because over time people stop noticing the risk and it's replaced by a habit. A simple way to stay consistent is using visible logs and written schedules instead of relying on memory alone. Section 4, shortcut culture. And honestly, this is where almost all compliance problems begin. Shortcut culture. When teams get busy, stressed, or overloaded, small shortcuts start feeling justified. Skipping one documentation step, assuming someone else completed a process, rushing room turnover, or bypassing verification systems. One shortcut doesn't usually create the disaster. It's the repetition over time that creates the risk. One of the best things leaders can do is create a culture where employees feel comfortable speaking up early when something seems off. High-performing teams don't hide problems. They identify them before they become bigger issues. Section 5, what high-performing practices do differently. So what separates high-performing practices from vulnerable ones? Awareness. The best offices train consistently, have written standard operating procedures and reinforce policies, create visible systems, and make it safe for employees to ask questions or raise concerns. Because strong compliance cultures are not built on fear. They're built on accountability, communication, and consistency. The safest practices are not the ones with perfect people. They're the ones with systems strong enough to catch small mistakes early. Here's the most important thing I want you to remember. Strong compliance protects patients, teams, trust, culture, and the long-term health of your business. And the safest practices are not the ones that never make mistakes. They're the ones aware enough to catch small problems before they become major ones. If you'd like help identifying hidden risks inside your own practice, Healthcare Compliance Associates offers a free 20-minute compliance risk review designed specifically for Oregon healthcare and dental practices. We'll help you identify where shortcuts may have become routine, where documentation gaps may exist, and what small improvements could reduce risk significantly. And if this video helped you, subscribe for more practical OSHA, HIPAA, and infection control guidance every week.